Hi everybody, we are here now. This is Nyoka Kratoff, Policy Manager with the Medicaid Development Administration Unit, and I also have with me
Rick Donnelly.
and
Hi, Stacy Collins.
we are all here with you today to talk about the transportation changes, non-medical transportation, and also what we're going to refer to, at least this afternoon, as routine transportation. So just to get a few, I guess first let's test things. Can everyone see the screen and hear me? Can someone respond and let us know? Okay, looks like yes. Very good, thank you. We're gonna get a couple of housekeeping things out of the way here first. I wanna let people know that the webinar registration was at max capacity. We were actually over. So right now we're okay with our numbers, but it's climbing. So if you log out, you may not be able to get back in. So that's important for you to understand. Also, there are no CEUs for this webinar. All of your phones have been muted. Any questions you have can be typed in and we will answer those. There will be a question and answer at the end. We're going to get to as many as we can, and any that we do not get to, we will have those and we will get those compiled and get those back out to you in a future posting. This webinar is being recorded and will be posted for you to review. The notice about that posting will be in a memo Monday. Once it's ready, we'll notify you and we'll get that information sent out in a memo. Okay, so let's get started on what's changed. Oops. Okay, effective 2/1/2020, for non-medical transportation, we did expand the definition to include additional locations. This included volunteer activities, post-secondary educational programs, internship, and practicums. So I know we have a lot of self-advocates that are very excited about those changes. So that's one change. We did add also $580 to NMT individual budget limitations for each cost of doing business category. This is in addition to the budget limitation, as is always the case. So in other words, that is just to be used for planning purposes. So if the individual's needs are being met currently with what they have, great, but it is there for people to use if needed. For NMT per trip, we removed the passenger size requirements, making all vehicle types eligible. So this is a change that I think is going to be a big impact on transportation as this all gets kind of rolled out and everybody adjusts to this change, because that is pretty significant. NMT per mile, we established separate rates for NMT in non-modified and in modified vehicles, and we're going to talk about rates a little bit later in the presentation, the specific rates. Whoops, sorry about that. For what we're calling routine transportation, HPC transportation, for per mile, we established separate rates for transportation in modified and non-modified, and then we also increased the DDP funding ranges. We did this also to encompass for homemaker personal care rate increases as well, but I wanted to kind of throw that in there, that was also a change. No, I'm just going to use this. For modified vehicle mileage rates, the mileage rate for a modified vehicle can only be billed if at least one person being transported has that need for that transportation, and that's in their ISP. So, and the other important fact is if the modified mileage rate is billed and the person is sharing services, it will be billed for everyone being transported, even for those who do not have the documented need. So let me say that without reading it. So in other words, if one person in the vehicle needs it, everyone in the vehicle gets it. So that's, again, different. It's a different way of doing things. And so that is something that we need everybody to kind of understand and work through. Communication is going to be very, very important between providers and county boards. And we made a really big effort in trying to get this training out to providers because it's going to be critical that the communication take place and we have all the information that we need. So in planning preparation, this kind of goes to my point, we need to gather information from the provider. So we need to know the current vehicle type being used based on need, and then the group size, because the group size matters. So how many people are in that vehicle? And then the SSA is going to do their best to estimate based on what you know about the individual and their needs. So the cost projection tool is going to be done exactly like it's always been done. You're going to project your very best on what is typical. So yes, that's going to change. It may typically be a group of 4, and one day it might be 3, but your projection tool is based on the typical. But you need to get that information from your providers. Roll-up codes, NMT per mile in a modified vehicle will be included in the existing NMT roll-up codes. So no changes there. But now that routine transportation has 2 vehicle types, modified and non-modified, there is a roll-up code for transportation as well. The roll-up codes are ATN, FTN, and STN, which are also billing codes. So I just wanted to point this out because I don't want people to get confused, and we're going to have a couple slides on this later. Rick's going to go over some of the system requirements and system entry information, and you could put in ATO, a different billing code, and have a roll-up code of ATN, and so that could throw people off. So I just wanted to point that out to you. Vehicle type, modified or non-modified, must be selected when authorizing NMT per mile or transportation. So you have to select the vehicle type in the system as you're doing your CPT. We do have a known issue in the system right now. I think I'm going to go ahead and let Rick talk about this.
So currently, if a county board is used to using the calendar, in other words, using the ADS and MT patterns to apply to a calendar, you're not allowed to add services under the ADS and MT unscheduled service portion of a cost projection tool if those dates overlap. So for example, my waiver year is January 1st of 2020 through December 31st of 2020. On the ADS and MT calendar, I apply patterns from January through June. Then the only time I could apply details under unscheduled services for that same waiver year would only be from July 1st of 2020 through December 31st of 2020. You won't be able to have services on the calendar from 1/1 through 6/30 and unscheduled services on the ADS and MT portion from 1/1 to 6/30. So they can't overlap. They have to bookend up against each other. Now, what we're doing in order to allow for the fact that several counties had already reached out to me and said, well, what we're getting from providers is now that per mile is just about the mileage, they're wanting to know whether we can authorize NMT per mile for during the day when they're doing community integration activities. So if you are a county board that uses the calendar, then you would need to add into the details. You'd have your adult day waiver service that's identified in that provider. You'd have the per trip piece if they're doing per trip to bring Rick or Noyoka to and from the day program, and then you would have the per mile element as well, based upon the fact that they may say, oh, on these days we're going to be doing activities in the community, this is the mileage that we want, and that's where you could include the information. Now, remember, as Noyoka talked about earlier, all we've added is an additional $580 to the budget. So if the provider is routinely using per trip, because that's what the person is requested to get to and from, and the person's using all 260 days, you only have a buffer about $580 to address those community integration activities. So just keep that in mind, but you can add those details as part of that ADS NMT pattern to the calendar. If you're a county that just does unscheduled, you don't use the calendar, then under unscheduled you'd have obviously your ADS detail, you can have your NMT per trip detail, and then your NMT per mile detail as well. It may be the same provider, it may be a different provider, because in some cases we know the folks that take people to their day program or place of employment are not their ADS NMT or not their ADS provider during the day. So you do have options, even though we currently can't allow for an overlap between what's on the calendar and what's under unscheduled, but you still can capture those details either in a pattern on the calendar or under unscheduled.
Okay.
All right, so go ahead.
I just wanted to say, I did not have this on the slide, but just regarding ISP and ISP revisions, we've had some questions about that, and I guess what we'd like to say about that is just, we're not saying that everything has to be revised necessarily by 2/1. However, we think that you are just going to need to kind of look at prioritizing things and what does need to be done, and working with your providers to see what really is the priority and what needs to be done, and just kind of taking things from there. Because there are things that are going to be a little bit more critical that needs to be done. Your roll-up codes are going to help you and take care of some things for a while, but then, the modified rate is higher, so your money's going to run out. So there are certain things that are going to need to take priority over others. So that's our best advice, is to just really look at things, work with your providers, and prioritize. So that's where we're at with that. Do them as needed, and certainly the next time the plan gets touched, opened, there's a revision for another reason or a redet. Now we have some screenshots just looking at the system and how it looks now, what's changed for those of you that haven't been in there. And again, I'm going to have Rick talk a little bit about these. Rick's the systems guy, so I'm going to have him talk a little bit about these.
All right. So as Noyoka already mentioned, in cost projection, one of the things that's been updated, so this first screenshot that we have is under the unscheduled section for ADS NMT. So this is where now when you're entering your detail, you'll notice that we've added vehicle type when we're looking at mileage. Originally this was only something that was an option when you were looking at per trip. So in this particular screenshot, this is relevant in this particular situation. We're looking at routine transportation. So under the unscheduled service portion of HPC and the unscheduled ADS NMT portion, when you're identifying per mile, you're going to have to identify the type of vehicle that you are authorizing for use, because that will affect the rate at which MSS calculates that dollar amount. So this is for unscheduled ADS. In addition, this actual screenshot is unscheduled HPC. So just to note here where the arrow's at, that we're looking at identifying the vehicle type. In this next screenshot, we're looking at a pattern that would be applied to the ADS NMT calendar. And as I mentioned earlier, you'll notice here we have the service, and then in this particular case, just to make it clear, we did a per mile item or an element that we attached to this pattern. And again below, you'll notice that we have to identify the vehicle type. So moving forward, it's going to be true that you need to identify whether it's modified or unmodified whenever you're addressing the NMT component for the service for folks. And just because it's come up a lot, I'm going to throw this out here. Yes, the PowerPoint will be available. We're going to be releasing this as part of the guidance that we're making available to the county boards and providers as a good resource. Because one of the things you'll see as we're going through here is Noyoka has kind of captured the rule in a very abbreviated fashion. It gives you all the high points. And then we included the screenshots to help users with navigating MSS CPT. And then further down, we're going to get into the rates and the billing codes, which are going to be very beneficial to providers. Maybe not so much for the county board folk, but more for the providers in the new codes that they will need to bill when submitting these new claims. So one of the things that we wanted to show here is after details have been added, we're drilling down through the non-medical transportation portion of cost projection. And you'll notice here that we have the span and we actually have group size, and we also have the number of units and the actual rate. This will drill back to a portion of the PowerPoint later on that shows the rates based upon group size that's going to be assigned. So it doesn't look any different than it ever has when you've been able to drill down into details in cost projection, because as Naoka mentioned a little bit earlier, some providers were concerned about whether or not they would be authorized correctly for when they're providing routine transportation, the modified vehicle service. So that's one of the other slides we're going to look at here in a moment. So here we have, so again, I kind of covered this one of the earlier slides, but just so if you're using this as a training document for some of your SSAs that weren't able to attend the training, here's a slide that shows basically unscheduled services for HPC. So this is where, again, as I mentioned earlier, you have to identify the vehicle type. It looks very much like what you're doing under the unscheduled ADS NMT portion of cost projection. They're mocked up pretty much exactly the same way. So it should make it straightforward, but again, we thought this might be a helpful training tool for some of your staff that can't attend. All right, so again, as Naoka mentioned, notice here we're looking at HPC transportation, and when we scroll down, when we look at non-modified transportation, so here's the roll-up code that will be in PAWS, which is what you've always seen. It will still be ATN. But when you drill down into this, you see that the billing code for a non-modified vehicle will also be ATN, but for where it's modified, sorry, my cursor's not moving, it's ATO. So for providers, don't be concerned that the PAWS only reflects ATN, because that's the PAWS roll-up code. Your billing code, you'll be able to see if you drill down, or you can ask the county board to send you a cost projection detail report, and in that report they should be able to demonstrate that per trip, modified, per mile, non-modified, per mile, modified will clearly be identified. So you can see that those elements are there. We just wanted to show that that is part of cost projection. It is something that both providers and county board users can see by expanding details in cost projection. And then again, here's an example of a cost projection detail report. Most of the county boards, if not all of them, are very familiar. These reports have been available since the launch of MSS in 2010. I know that many counties use these as part of an attachment to the ISP to show the provider what they're authorized for, so that for those providers who aren't as comfortable with PAWS, they can use this document. And again, we can see here, here's our main roll-up code for the service, and then here's our breakdown. Under the red arrow, we have the ATN, which is the non-modified, and here we have ATO for the modified. These details match what was in the prior slide. All right.
Okay, so the level 1 emergency rule did not get opened up at the same time as the other rules, so we're a little behind on that one. That will all be finished up by March of 2020. So ETO, which is the emergency transportation for modified vehicle, will be available in all of the systems by March of 2020 with a date effective 2/1 of 2020. So we just need to make sure everybody understands that. There are not, based on our information, there are not a lot of users of that service, but we just need to make sure that everyone understands that, what the availability of that service will be. So here is, we're not quite done yet. There's a few more slides, and then we're gonna scroll through some of the questions here. But any questions or concerns or issues, this is the MSS support email, and then my email. And then I don't think my phone number's not on there, but you can send my email, and I can send my phone number if we need to talk. Some of this is sometimes easier to talk through as well. So certainly contact one of those two places. Here is, we thought it would be easier for some SSAs to have the billing codes in one place. So here are the non-medical transportation per mile, per trip, billing codes for all of the waivers. The same for the transportation. And then here are the new rates. And then we have here at the bottom, no changes to NMT per trip. So, and NMT and transportation have the same, now they have the same rates.
You know, I want to double check something, because I was listening through the course of the webinar. Did you elaborate a little bit on the fact that for the non-medical transportation providers who were doing the per mile billing, what may need to be taken into consideration because of the rate adjustment that's occurring?
That's this
okay,
next slide.
my
Yeah.
apologies. Sorry,
That's okay.
got ahead of myself.
So when we did the new rate structure, previously non-medical transportation rate included the driver cost. This has been removed with the new rule, the new rate effective 2/1/2020. So the provider may now bill for the driver time if they're certified in a service, and they can bill for the driver's time then, and in that service. Of course, that has to be approved in an ISP. So that has caused us to get quite a few calls. Providers are not understanding that initially, so they're just seeing the reduction. They're not understanding their ability to bill their time. There are also some providers that are only providers of NMT. They're not providers of a service. So that is one example of a time where, again, I think providers and county boards really need to communicate, talk, and work together on how that can work, so that if the individual wants to continue to have that provider, what can happen there? Does the provider need to become certified? Is that the best way? Does that provider begin to bill per trip? What are the options? But that's a conversation that needs to take place back at the county, and with the board and the provider. So, but that's something that I wanted to point out and make sure that everyone understands, because we're getting a lot of providers who seem to just be realizing that that's the case. So we want to make sure everybody understands that. That would be an example of a situation where that would be a high priority change that would need to take place, because a provider is going to need to have some changes made there. On behalf of mileage prior to pickup and after drop off, mileage driving to pick up a person and after dropping that person off is not considered an on behalf of service. So this driving to pick up the person and dropping them off is not billable. This applies to all types of mileage in all three waivers. So this has come up a few times, and so we wanted to get this in here. And again, we're going to be distributing this PowerPoint as a form of guidance. So we want to make sure that everyone gets that information and understands that. So commercial transportation, there were no changes in the rule, but we did want to kind of talk a little bit about it, because we want to encourage people. There are commercial transportation includes things like bus passes, and creativity with this service of commercial transportation. If it's available in your area, we understand there are certainly small counties and places where it's not necessarily available, but within the realm of specialized services, ensuring health, safety, and welfare. But it helps increase independence and community integration. So it is certainly permissible. So we want to continue to expand our possibilities under this service. So we're willing to talk to any county or provider that wants to know more about this service and how it could be utilized. So, sorry. So sorry. Okay, so
Let's do this.
let's.
So what we're going to try to do, is
Go
we're
ahead.
going to try to see if we can't hit the high point questions. We actually have roughly about 30 minutes left, so we made pretty good time getting through the material. And again, as both Noyoka and I have mentioned, because this has been a constant theme, I've been reading the questions as they've been coming through fast and furious. It is going to be posted. It will be probably attached to Memo Monday, so that it's something that you can download hard copy, or you can save electronically if that's your wish. So it will be available. It's just not going to be right after today's broadcast, because we want to be able to get some other information put together as part of what we put in Memo Monday for the release.
Mm-hmm.
So I'll be honest, as I was scrolling through these, there's just a wide variety of questions. I don't know that I can catch
It's okay.
the same question multiple times. other than, of course, about the PowerPoint. So I'm just going to suggest we start at the top and see what we can get through
Okay.
in 30 minutes if that's acceptable.
Yep.
So again, understand anything that we don't answer during the course of the last 30 minutes, as Nayoka already mentioned, we're going to be doing frequently asked questions. Even if it's something we cover here today, we still will go ahead and make it an FAQ if it's something that we've seen was asked a lot, because other people might not be able to attend this and have the same question. Okay, so I'm just going to read these so that everybody knows what the question is. So it says, how is it expected for county boards to know and keep up with modified vehicle if modified vehicle authorization is needed? In other words, strictly due to another person being transported with them who may require the modified vehicle. So that's, I'm going to stop there because there's a lot of additional information.
I would say I'm not saying it's not going to be a challenge, but I would say the best chance of that is going to be the provider. If the provider is going to bill modified, they're going to have to keep county boards updated. That's my best answer for that. So if they don't keep the county board updated on their authorization to bill modified, then they're not going to be able to bill it. That's really the best answer I have.
And if I could expand a little bit, because there are some other questions that came through
Sure.
that are along this line. People were asking, well, when would we authorize modified? When would we not authorize modified? So as Nayoka talked about on one of the initial slides, we have 3 people living together in a residence. It's Nayoka, Rick, and Debbie. We all live in the same home. Nayoka is in a wheelchair and requires a modified vehicle for access. So I'm going to just talk from homemaker personal care perspective. So if Nayoka goes and does her grocery shopping independently, or she does some one-to-one activities, then obviously we're looking at the modified vehicle per mile being authorized. But anytime where, and this is something the provider can talk about to some idea, and so again, as Nayoka mentioned, you might have to approximate what you believe to be the case for mileage throughout the course of the year, where it's likely that Nayoka is going to be with Debbie and Rick. But if you want to identify to the level of what's 1-to-1 or 1-to-2, and knowing that 1-to-1 and 1-to-2 doesn't include Nayoka, and it's only the 1-to-3s that have her, then that's when you're looking at the modified per mile rate as opposed to the non-modified. And trust us, both Nayoka and I are very familiar with the fact that people's service delivery is very fluid. Things change routinely. But that's one of the challenges with this, that providers, which is why this was open to both providers and county boards, are supposed to sit down and think about what seems reasonable throughout the course of the year. Because again, cost projection is an approximation.
Of typical, right? So you're looking for typical and understanding that that's going to change. So if I authorize what's typical in that house is a group of 5 and one person makes that modified be required and they're homesick that day, that's okay. It doesn't have to be perfect. It's an estimation of what's typical. So I don't know if that answers that question. Again, you're just doing your best to get what's the typical schedule, and variations from that are okay. Especially if you're authorizing modified and you're going the opposite direction. If you're authorizing non-modified and you're quite often using it, and the provider's quite often billing modified, that's going to cause you a problem because the money's going to be depleted. So if you're authorizing modified and going the opposite direction, it's probably not as big a deal. Again, if it's not happening, all the time.
So if an ISP, okay, I think the question is, does an ISP need revised to include for modified vehicle, or I'm going to read the question. Unfortunately, no offense to the person who wrote this, it says, if an ISP needs revised to include the need for a modified vehicle, do we need to reobtain signature? My apologies, actually that reads correctly. It was me interpreting it incorrectly. So if you're having to do a revision to the ISP about the type of vehicle that's being used, yes, a signature would be required. All revisions to ISPs typically require consent by the individual and the team people that are providing the services.
Yes.
All right. Okay. If a provider chooses to have a modified vehicle at the shared setting home, but the individuals in the home do not require a modified vehicle, do we authorize the non-modified rate or the modified because the provider is choosing to use a modified vehicle? So the answer to that is you'd authorize the non-modified rate. Again, it's about the individual's need, not about the vehicle being used. As we've already mentioned several times in the course of the webinar, the only time the provider should be billing modified when we're talking about routine transportation is because one or more of the individuals being transported at that time requires the modified vehicle. So in the situation where I said Noyoka, Debbie, and I live together, but Noyoka is the only person that needs the modified vehicle because she uses a wheelchair to ambulate, the only time they should be billing the modified rate is when they're transporting Noyoka or Noyoka with Deb and Rick. Otherwise, if it's just Rick or Deb by themselves or just the two of them, we would expect them to bill the non-modified rate. And again, we know that there's going to be a lot of scenarios that are going to come up that can't be captured in the webinar, so we really do expect either you can email Noyoka, you can email MSS support, and we'll reach out to you and we'll have a conversation if we need to walk through the intricacies of what's going on there. All right, so if someone lives with housemates and all the housemates require a modified vehicle, how should it be authorized for one-to-one mileage when the person who doesn't require it is being transported when this is the only vehicle available to use? I think we've answered that question already. Sorry, folks, sometimes in the process of reading through, I might not realize it's the same question, just worded differently. Okay, if only one person needs a modified vehicle, but everyone gets in, that's the same.
Yeah.
Oh, so this says, does it need to be included in the individual who doesn't need an IP? So
No. It only has to be in the person who needs it, their ISP.
we understand that what you're asking is, but we're authorizing modified for the roommates when the group size includes everybody and the person who also has the need for the vehicle. But as Noyoka mentioned, we really need you to just call for that specific person. I don't think you're going to have too many questions. You can let me leave it at that. Sorry, I'm bad about elaborating, as most of you know. Okay, so what consists of a modified vehicle?
That's in the that's in the rule. Yeah, it's a basically it Rick's getting the rule quote, but it's a permanent. It's a permanent change to the vehicle.
Okay, so the answer is actually rather lengthy. So in the current rule, it's under paragraph B, which is the definition section. It's item number 15, and again, I don't expect you to remember that, but for some people like me, they write stuff down. So under item 15, under paragraph B, it goes into a list. So for example, it says, a vehicle that's been structurally modified in a permanent manner to be used upon public streets and highways for transportation of individuals whose physical or behavioral needs require use of a transfer aid. Or a motor vehicle that has been designed, constructed, or fabricated and equipped to use upon public streets and highways for transportation of individuals who require use of a wheelchair, and that shall. And then there's a whole list of things that go along with it. So the rule's pretty clear about what constitutes a modified vehicle. That should really help you as a provider to know whether or not your vehicle is modified, and for the county board to ask questions when looking at potentially authorizing that service in the ISP.
Right. So we're up to what does modified versus non-modified. Right there.
So.
Yeah, it does not. Does modified versus non-modified apply to per trip billing? No.
So then the expectation, if it's per trip, is that it is a modified vehicle?
No.
Okay. Because I think
Right.
that may be what they're
Per
trying
trip,
to get to.
right? Per trip, all of those requirements have been removed from per trip, and so per trip can be done in a modified or non-modified vehicle.
Okay, does the need for a modified vehicle need to be in the assessment as well, or just in the ISP as the service code, as our assessments just identify the support, not the service? So I guess you're asking if the assessment has to address the fact that the person needs a modified vehicle.
I mean, the rule says the ISP. However, I would think depending on what that modification is, that might also track back to the assessment. So if it's a wheelchair, that might also track back to whatever the need is. So the rule does not say that, but however, I think your assessment needs to support your ISP. So you may also have some references in your assessment that would support that modification as well, I would think.
I mean, the bottom line is that if it's your county board stance, and I mean this to all the counties that are there because it varies from county to county, about how you want to capture what you put into the ISP as far as an authorization for service. It may be that when you're looking at talking about the person's ability to access the community and what types of assistance they need, you might identify that the person has a gait belt, or the person uses a wheelchair to ambulate, or the person needs a modified vehicle in order to be transported in their wheelchair to get to the community. I think it's also something that's fairly typical that an assessment process isn't always driven by paper. Part of it's a conversation that occurs with the SSA and that individual and their team. So it may be captured in TCM notes, or it could be part of a formal assessment that you have. I don't think we want to dictate to the county boards that that's mandated since it's not rule, but we are saying that the ISP does need to capture the type. So your assessment process could be paper, or it could be part of a conversation captured in TCM, or even in a discussion section in the ISP if that's what you do.
Mm-hmm.
Okay, somebody had written, verify that we can bill as a day program provider for community integration. I'm not certain what you mean by that. So once again, in order to build community integration, staff have to have gone through the specific training. We're talking about no greater than group size of 4 people as part of that situation. And the ISP should be very clear about what type of activities the person has requested to be part of that. We don't just want it being put in that community integration will occur when Rick attends ABC provider. Stacy, did you want to add something? It looks like you got something you'd like to say. Please feel free.
I may be leaning. So
What does that mean?
I just wanted to, I'm thinking the question could be taken either way. So I think that you're right. If you're asking about, is this allow you for the community integration add-on to the adult day support service or the vocational habilitation service, there's certain requirements for that. But if you're asking the question, does this allow you to get reimbursement for getting individuals out into the community? I think it's important to note, and Nyoka and Rick mentioned this, that this does allow you now, if you're billing a service, so if you're billing the adult day service and you're taking groups of people out, you are allowed to now be billing transportation along with the adult day support service. So I just wanted to add that in, that this has been something previously that you haven't been able to do. If you're doing vocational habilitation, you're trying to get individuals out in the community, you had to choose before either the service or transportation. You couldn't do them both together. Now that these are aligning and this has been modified, you can do vocational habilitation and transportation for taking individuals out as long as you have that authorization.
And you're billing per mile.
Correct. See?
But no,
Yeah.
but that's
Yeah.
good. Thanks, Stacy. I wouldn't even
I
thought
don't know
of
if that's
that.
helpful, but
I think it is, because it
Yes.
wouldn't have been something I would have thought of, and I think that there are probably people that are doing that aren't looking at necessarily that the community integration as the add-on that's available through those services.
thank you.
Okay. So individuals can use per trip for NMT and per mile for community-based activity transportation, correct? Yes.
Yes.
It doesn't have to be per mile for both to use both. No. We're going to be in chorus here before too long.
Hi, Dawn.
Okay, it says, can you say more about why the ISP needs updated at all?
The CPT will need updated with mile, but it's already in the ISP. Well, eventually the ISP will need updated because the rule says that if it's modified, the ISP would need to talk about modified modified transportation. The other thing would be depending on what, as I said, different circumstances, depending on what the provider needs, things like that. So that's why I said prioritized depending on the situation and what the needs are. So I think there are circumstances where the ISP is going to need to be changed. And then eventually all ISPs will need to be reflective if there is a need for modified transportation. So I guess I should have clarified that piece if that's part of this question. I'm not sure. So hopefully that helps.
Okay. I think this next one is an example of something we've already touched on. It talks about 3 individuals living together. Only one individual needs the modified vehicle. Do you pick modified for all 3 because it said that one of them needed it? And again, I'm just going to re-emphasize this. So there's another question. It's kind of like other people have been asking about, when do we authorize modified when only one person in the home needs it? So again, it's only when that person who needs the modified vehicle is out on their own, or if they're in with one or more of their roommates, and the person who's part of that activity needs the modified vehicle, all 3 will be billed at the modified rate.
Right. Now, I wonder when they say pick, though, the one thing I do want to clarify is you will have to, in the CPT, you will have to authorize modified transportation for the other 2 people. So I'm not sure when they say pick here, or do they mean pick on the CPT? So,
You can cover a couple of
did,
things.
Yeah, we did say you do not have to have modified transportation in the ISP for those other 2 people. But on the CPT, you will have to have some because the provider will be billing that higher rate. So you will have to have that on the CPT.
So Janice, for an example, when we're looking at the HPC unscheduled, we might have 1-to-1, and this is for Naoka who needs the modified vehicle. So for her, all of hers are going to be at the modified rate, whether it's 1-to-1, 1-to-2, 1-to-3 in the scenario I presented. But for Rick, when I'm doing 1-to-1 and 1-to-2, that's the assumption that you're putting in because that's Rick by himself or Rick with Deb. We know that those are the unmodified, but when we do the 1-to-3s, again, and this is my scenario, it could be different, we know that's going to be at the modified rate because when it's 1-to-3, we know that Noyoka is part of the mix and that has to be authorized as modified since she needs the vehicle. So there are a couple of things with that. And again, if you run into that when you're going through updating cost projection because of changes that need to be made, because the circumstances warrant it, if you've got questions, again, email MSS support. We actually expect quite a bit of email around this initially until people get a little bit more comfortable with the circumstances. Okay. What if the rate changes put someone in need of a prior authorization or a budget adjustment due to increased costs? So again, if I think, in the case of a prior authorization, because we're looking at, well, see, that's where I don't know because, it could be mileage, so my apologies. I'm trying to think through the examples. So again, you would submit a prior authorization or a budget adjustment if a prior auth's already been submitted. If somebody's going to exceed their ODDP or they exceeded a prior authorization you submitted for that waiver year, it's still the fact that you've assessed that there's a need for the person and this is the cost of service to meet those needs and that you submit a PA. So it really isn't any different with that. With budget, I'm assuming a budget adjustment, it's the same thing. So this is where you've already done a PA. I'm sorry, so the first example was there was no PA. The second one was there was a PA, now you're doing a BA. So the bottom line is, if it puts them over, then you're submitting a PA if that's the first time round, and you're submitting the budget adjustment if a PA has already been submitted. But now, once these changes go into effect in February, you find that the cost of the mileage is going to bump them over their DDP range. So you would still submit a prior authorization. Okay, so
13 vehicle inspection as most 12 to 15.
So the next question is, will we have to have routine vehicle inspection at most 12 to 15 passenger vehicles? So right off the bat, both the HPC transportation rule and the HPC transportation rule actually doesn't speak to inspections, Now, the non-medical transportation rule does speak to vehicles having to be inspected on an annual basis, and I believe that requirement is still in place. It doesn't.
Over 5 passenger, I believe.
Okay, so it doesn't. So if it specifies over 5, then those requirements, because there was a requirement that they had to have it done annually, and now they're looking at a 5-person.
I think it's 5 passenger or greater.
Sorry, folks, that one we have to look up. If you want to move
Yep.
on, take a look
Yep.
further to that.
Does the ISP need to specify whether transportation is per trip or per mile? Yes, I think in most cases you'll need to, eventually that needs to be there. I think, again, that's one of those things that I don't think it has to, we have to have those things done immediately, unless it's, as I said, the provider whose rate is, having a problem, but
There's going to be a decrease because they're no longer getting
Yeah.
the piece of supervision that was in
Right,
place. So that's
right.
where you're looking at the whole thing about whether or not. So when we were discussing Noyoka and I, and actually several other people in the policy group here, there's a couple of alternatives. So again, we're not saying that any of these is the way you have to go. We're just putting it out there. So it may be that you authorize per trip under non-medical transportation, because again, now the vehicle requirement restrictions are out of the picture, so that person who's driving a regular vehicle can basically provide the per trip in a vehicle that's not capacity or necessarily modified. And so that may take care of the issue. Or you look at them being able to bill the service while they're providing the mileage in billing per mile non-medical transportation, because the supervision piece is out. So
Right.
those are two of the things that we've come across that we thought are options. That, of course, is at the
Right.
discretion of the county board. I found where it said in the rules, so Noyoka is correct, it states here, when a modified vehicle or a vehicle, so it's modified or a vehicle equipped to transport 5 or more passengers. So it does say that there is a requirement for an annual inspection for 5 or above. So your 12 to 15, what it says in rules, it can be done by the Ohio State Highway Patrol. We know for a fact that the department, they aren't often willing to do that, so you can have a certified mechanic also do that inspection, and obviously you need to keep documentation that was completed at least annually.
Right. So as far as the per trip and per mile, again, this goes to, there is the roll-up code and all of those things, so, but it is something that I would say, at some point needs to be identified. I don't think there is a way to expand all. So the question is, on the cost projection report, is there a way to add an expand all button so we don't have to click? Is there a way to add it? That I don't know. That would be something we'd have to ask.
We can look at that as an enhancement. The reason right now that it doesn't exist is because it depends on the county board and the provider what details they want to expand to print the report. So that functionality has been the same since we added that to the application back in 2010. But we'll make note of this when we're going through these questions as something we can talk to ITS about, having one where you just click and it says expand all.
Mm-hmm. So can the non-modified rate be billed for individuals even if they ride along with an individual that needs a modified vehicle and you are billing modified rate for that individual? Groups change daily, so it would be hard to predict who would also be with that individual that would require modified rate. Community integration during adult day services.
Okay, so again, this is a question that actually has already been asked, and again, I think that if one of the folks that's in that vehicle that's being transported requires a modified vehicle, the provider has to bill everybody in that activity that's going out or on the way to day programming or to employment at per the modified rate. There isn't a way to splice and dice it. So this is where, again, we realize it's going to be a lot of work up front to get people to have that level of communication when they're meeting to talk about services for the individual, especially when the individual either themselves needs a modified vehicle and they live with other people who don't, or the converse where I don't need it but I have a roommate who does and I do get a lot of transportation with them. And it's going to be a learning curve. Okay, I'm an independent provider. I have one client that I drive an hour a few times a year to doctors and dentist visits. I've been taking him for years and I was not sure if I can get reimbursed for gas mileage or not. So again, the bottom line is what was authorized in the ISP by the county board for when you were taking the individual to appointments. Many county boards, I don't know about all, but many county boards typically will authorize a provider in mileage when you're transporting somebody to a community-based location to receive a support. So if you're taking somebody to the grocery store, you're taking somebody to the bank to cash their paycheck or deposit their paycheck, whether you're going to medical appointments, it would seem reasonable that mileage would have been authorized as well as part of that process.
Mhm.
Okay. Sorry, we're wanting to read through the question first before we read it out loud, just make certain we got it down. It says, how can you estimate community miles in a county that uses schedules? Does that not take away choice to let them us as they want to? We're not saying that the county board is going to be prescriptive about when they are identifying per mile when we're talking about, I assume when you say community miles, you're talking about community integration, because I don't know if you're talking about community integration or as Stacy mentioned earlier, if you're just talking about doing activities with people in the community and you're not looking at community integration. I mean, right now the county boards have to authorize HPC mileage based upon an approximation of what they believe the person will need during the course of their year or per fiscal year or per month. So this isn't any different than that whole process where the team's going to sit down and talk about those activities and try to figure out what makes the most amount of sense. And again, if things change and there's a greater need that needs to be met, the team can convene, have that conversation, and amend the ISP appropriately. I don't think we're doing actually a whole lot to increase choices for people, not limit their choices. And if I'm not catching that again, you're welcome to send more specific details to MSS support, and then I can reach out to you and we can have a conversation about that.
Yeah, because I'm not sure we're getting that.
Okay. Will the codes reference be provided on a separate sheet instead of a PowerPoint? This would be more beneficial to SSAs. When you print the PowerPoint, you typically print it per page. So technically you cannot include the pages you don't think the SSA needs and only include the rates and the codes as separate handouts if you want to use them that way.
The rate, so the question is, so what rate do I bill at for regular per trip NMT, modified vehicle? And the NMT per trip did not change, so you're going to use the same rates and rule that we've always used. If you need help with that, certainly email and we can, get that to you.
Alrighty. Okay, it says for those counties that requested the rate automation for the new rates and the units were in as span, did all of the units get changed to the new rates, even those prior to 2/1? So first of all, that hasn't occurred yet. So we would have to really touch base with Jessica, but my guess is what we said would occur when the automation process is done for the county boards that opted in and gave consent. Because NMT is defined already, we don't have to worry about NMT so much, but when we're talking about HPC, it's going to be assumed that it's non-modified. So that's where everything, as Noyoka talked about earlier, may go into pause and look no different, but if in the conversation with that individual and their team, that individual needs a modified vehicle or that person is going to be getting some services in a modified vehicle because of people they share transportation with who do, then the county board is going to need to probably prioritize those ISPs for revision since they need to identify a modified vehicle and update cost projections so that PAWS will show the additional funds. Because right now, obviously, there's already the codes, the PAWS roll codes are staying the same. It's the billing codes that are changing, as Noyoka already referenced. So the bottom line is you have time in order to get these changes in effect because there's already units and dollars authorized in PAWS. And those PAWS codes are still good. But if you do see somebody who's going to be looking at a lot more modified per mile than what they were doing as far as non-modified because of how the rule changed, then those are, again, ISPs that you're going to want to prioritize and make certain you get cost projection updated and new PAWs enrolled so that the funding is there for the provider to bill and be reimbursed.
I want to do these last.
Sure.
So this one, the NMT per mile, 1 to 3, the largest ratio. I went back to this slide. So here are your ratios. You have 4 or more for NMT per mile. So, and can trips be taken during the day and NMT billed for groups larger than 3?
Mm-hmm.
So the answer is yes. So that's that slide. And then this one here, someone asked us to go back to slide 17 for a minute when we get to the end. So that is this slide with the billing codes. So someone wanted that. And I think that's, yeah, we're not touching EBV. This I would assume has something to do with someone who's going to bill HPC. Does NMT per trip include the driver's time, or does NMT per trip and ADS services still need to not overlap?
So
Per trip,
it does include.
yes.
So per trip didn't change, as Noyoka already mentioned. So that still includes the supervision by the driver. That didn't change. It's only per mile that we took away the supervision piece. And that's why the provider is able to bill the service that they're providing at the same time they're billing the mileage when they bill the non-modified NMT service. Okay, it's just that we wanted to level the playing field with transportation, and the reimbursements were the same. We left per trip untouched.
This person's already left, so we're not going back.
Yeah.
Planning driver time, what service?
Okay, so can you talk? Sorry.
That's okay, I'm sorry.
It's all right.
I-
It's all right. So can you talk more about the billing of driver time, what service? So, and this will be the last question that we're going to be able to answer. So again, when you're billing per mile, and again, per mile under HPC, the provider has always been able to bill, and the county board has always authorized homemaker personal care in conjunction with transportation. It's when we're looking at per mile in NMT that it's now different, because again, we're looking at that provider potentially billing adult day services, billing vocational habilitation, potentially I'm taking people over to their site where they're going to be doing their enclave,
Right.
and so I'm going to be billing group employment support.
Mm-hmm.
So that's what we mean by the service. It's going to be relevant to what is the activity that you are engaged in supporting the person in, and what is the service that you're wanting to bill. So HPC transportation really, with HPC transportation with homemaker personal care really hasn't changed, other than we've added a modified versus a non-modified rate. It's really with NMT that we're looking at a difference, because we're talking about the fact that now when I bill per mile, I can bill that service at the same time. All right, and with that, we have to wrap up.
Right.
So again, if you've got additional questions that you weren't able to get here, first of all, we're going to be able to print these, and so we're going to use these to develop our FAQs from.
Mm-hmm.
And then also, if you have additional questions, Noyoka kindly put up email addresses that you are welcome to send your questions to, and we'll do our darndest to answer those to the best of our ability, and realize we're all kind of on a learning curve, so there will be aha moments that occur throughout the next couple of months. All
But
right?
we will figure it out together. So don't hesitate to email or call, and we'll work it out. Thank you, everybody.